Hello, my name is Dr. Peter Marincovich. I am the owner of Audiology Associates, and we are creating hear and see educational videos to help patients and companions understand different aspects of hearing aids and their use and care. And this is the first in our series, and today we will be discussing how to properly insert and remove a hearing aid. And I have three different styles: a behind the ear, a in the ear, and a open fit hearing aid, and I will be demonstrating this on my right ear. And what I'd first like to do is to show the technique for inserting the hearing aid, and then finish with the technique to remove the hearing aid. The good news about all three styles is the same process is applied to all three. There are some slight differences which I will review, but basically I'll start with a behind the ear hearing aid. And the first step after identifying the appropriate left or right ear is to find the tubing where it enters the ear mold, and simply pinch the tubing at the juncture of where it enters the tubing. So this is a right hearing aid, a right ear hearing aid, and so I'm holding it with my right hand, and I have the ear mold pointing towards my right ear, and the hearing aid I actually take and put between my thumb and index finger. So as opposed to having the hearing aid loose and about, I tuck it between my thumb and index finger so it is somewhat held in place. So I use the tubing as a handle to bring the hearing aid up to the ear. If I were to grab the tubing somewhere up the tubing, the ear mold, you can see, is loose and would move back and forth, and there's not a good angle for inserting it into the ear canal. So basically, again, grab the tubing right where it enters the ear mold and use that as the handle. Take the behind the ear part of the hearing aid and actually tuck it between your thumb and index finger. The second step, now that you've identified the right ear and you have it positioned how it's going to go into your ear in front of you, and you have the hearing aid tucked out of the way, the next step is to look a little bit, in this case to your left, for the right ear, and you would look to the right for left ear insertion. But the idea is that when you bring the hearing aid back to your ear, you're not going to rotate your hand. You're going to bring your hand straight back. So if you're simply looking straight ahead, you actually have to get your arm and shoulder way back to reach your ear, and that can be difficult. However, if you turn your head a little bit to your left, you can see that it's much, much easier to get the ear mold to the ear. You don't have to bring your arm as far back. So again, after you have the hearing aid, you're holding it directly in front of you. Turn your head slightly to the left, again to the right for a left ear insertion, but turn your head slightly to the left and simply bring the hearing aid straight back. In other words, don't rotate your hand as you bring the hearing aid back. If you did, now the hearing aid would be upside down. After you're holding it in front, just bring it straight back. The ear mold will simply insert into the ear, and I recommend to patients that they bring the opposite hand around and hold the mold and simply take the hearing aid and tuck it behind your ear. And that's inserted properly. To take the hearing aid out, the best thing to do, find the behind the ear portion, come down, find the tubing, and again pinch it right where you pinched it to insert the mold, and simply pull the mold up and away. And this will remove the ear mold from the ear quite easily. If you pull the mold forward or backwards, it tends to lock in your ear. The best thing to do is simply pull it up and away. So that's the insertion and the removal of the behind the ear hearing aid. Again, to review, the key is to grab the tubing right where it enters the ear mold as a handle and get the hearing aid out of the way by tucking it between your thumb and index finger. Second is find the hearing aid, get ready for positioning, and then turn your head to your left, bring the ear mold straight back, don't rotate your hand, simply push it into the ear, bring your other hand around to hold the mold while you take your other hand and put the hearing aid behind your ear. To remove the mold, simply find the tubing, pinch the tubing, and lift it up and away from your ear. The next hearing aid I will demonstrate this process with has to do with an in-the-ear hearing aid. So again, after you've identified the left or right, this is again a right ear, you're holding the hearing aid in front of you the way it would go into your ear. The outside of the hearing aid has the battery door, which I just opened and closed, and this portion with the white receiver protector tip is the portion that goes into the ear. So you will, similar to the behind the ear, you hold the hearing aid in front of you the way it's going to go directly into your ear. And when you bring it back to your ear, again, you're not going to rotate your hand. And the same process, turn to your left, in this case, because again it's for the right ear, you'll turn your head to your left and the hearing aid comes back to your ear. You'll find this position and simply push into your ear and it will insert. To remove the hearing aid, with the in-the-ear hearing aid there's no tubing, so you will simply use your thumb, kind of use the nail of your thumb like a shoehorn, simply put your thumb underneath the bottom of the mold and just lift up, and the hearing aid will again come out of your ear easily. If you try to pull the hearing aid forward or try to pull it from the top down, it tends to lock into the ear. The best way to remove an in-the-ear hearing aid is simply put your thumb underneath the bottom, kind of insert it between the bottom of your ear and the hearing aid, and just simply lift the hearing aid up and it will remove on its own. The third and last hearing aid I want to review with you in terms of insertion and removal is what we call an air hearing aid or a RIC hearing aid or a right, where the receiver is in the ear. There's very little ear mold, if any. Again, the hearing aid is behind your ear, but the same process somewhat. After identifying, again, this is a right ear hearing aid, the first step is to, with the RIC or the right hearing aid with these small thin tubes, is to, I recommend, simply put the hearing aid over your ear first. This way you have a secure holding for the hearing aid to work with. The way we measure these tubings now is it is already measured and fit to your ear, so it should almost go in by itself. You simply push the little tip and it will simply insert into the ear canal and it's set. This type of hearing aid, I don't recommend trying to put the tip in first and the hearing aid behind your ear, because the tubing is thinner and it doesn't support the hearing aid as well. So I recommend putting the hearing aid over your ear first, using your ear as a support, and then simply pushing the receiver into the ear canal. The removal of the hearing aid is very similar to the behind the ear, where again you're finding the portion that goes into your ear, the tubing, pinching it, and again just lifting up and away, and the hearing aid will easily remove. So that demonstrates the insertion and removal of behind the ear, in the ear, and a open air or RIC or right behind the ear hearing aid. And please stay tuned. We will have additional videos and educational presentations to help with other aspects. So thank you very much. Bye-bye.